Assalamu alaikum everyone, myself Dr. Ayaz Ahmed and I'm talking to you on behalf of PNMDP. Today very important topic, congenital adrenal hyperplasia, disorder of sexual development, which investigation should I send first? Many candidates found it difficult like what should I send, whether the electrolytes or 17-OHP or karyotyping, and these are the examiner's favorite questions in MRCPCH and FCPS. So let's start with the scenario. A 40-weeker born with ambiguous genitalia. So here the first question is, what should I tell parents? And the second question is, which investigation should I send first? So question one, like what should I tell the parents? So always remember, a senior person should always talk to the parents. So always remember, have discussion with the parents in counseling room. Explain to the parents that it is not possible to tell whether their infant is a girl or a boy. Please don't guess the sex or even voice your suspicion, as this can be unhelpful to the parents. Also discuss with the parents that the registration of the birth must be delayed. Also have a discussion with the parents about whether they want to name their baby or not at this stage. Also provide clinical psychology support to the parents. One important thing, the baby should be referred to as your baby or the baby and never use the word it, he or she. So the next question, what investigation should I send first? So first of all, I will discuss with you a child with a suspected DSD may present with one or more of these features. Number one, severe hypospadias or bifid scrotum or bilateral impalpable testes or clitoriomegaly or micropenis, and obviously the congenital adrenal hyperplasia will be your most common differential here. So first line test which I'm going to discuss with you, that should be performed within 24 hours, the blood test and imaging. So in the blood test you should send QFPCR, which will identify the presence or absence of the Y chromosome, which will help with the sex assignment, and the karyotype, and this test will confirm the presence or absence of Y chromosome identified by the PCR. And if the imaging facilities are available, go for the ultrasound pelvis, but this is not the emergency. This test can identify the presence or absence of Mullerian structures and help with the sex assignment as well. The second line test, that should be performed after 72 hours, because initially there will be the false positive results, as 17-OHP usually raised after the birth. So after 72 hours, go for urea electrolytes, cortisol, glucose, and androgen profile, which includes 17-OH progesterone, testosterone, androstenedione, LH, FSH, and urine steroid profile. Further investigations that can help you in case of DSD, HCG stimulation test, genetics, and imaging by laparoscopy. It's also worth mentioning here that congenital adrenal hyperplasia is caused by autosomal recessive gene mutation. Majority CYP21A1 mutations result in 21 hydroxylase deficiency, and neonates typically present with virilization at birth or in shock salt losing crisis around days 10 to 14 of life, although some children present later with simple virilizing CAH. When you are sending 17 OHP level, as I already discussed with you, should be after 72 hours of life, but seek advice in premature or very unwell infants, as 17 OHP levels may be elevated in these babies. And in an older child, blood for 17 OHP should be taken early before 8 a.m. as unlike in young babies, there will be a circadian rhythm. If 17 OHP level is equivocal, and if you are suspecting congenital adrenal hyperplasia, go for senectin test, which will measure cortisol at 0, 30 and 60 minutes and 17 OHP levels. And if senectin test is equivocal, go for the genotyping to look for CYP21A2 gene. I will advise when you are sending first line investigation in 24 hours, always seek advice from pediatric endocrinologist for further investigations. I will discuss with you what question you will ask in history and how will you examine such babies in a different video. I have also shared some links in the video to give info to the parents. Livingwithcah.com and BSPED congenital adrenal hyperplasia. My references are Nelson Textbook of Pediatrics, Gomela, Archives of Disease in Childhood, and US Endocrine Society. Thank you very much, and please subscribe our channel and like our page on facebook.com/pnmdpp.